Okay, good afternoon, everybody. I think we'll get started. My name is Chris Reagan. I'm the director of the McGill School of Public Policy. Welcome to today's installment of our Policy Challenges During a Pandemic series. This is number 12 or 13, something like that. We've been covering lots of different topics. Today's topic is about food. We've all been enjoying food, possibly too much, in the last 4 or 5 weeks. But today's talk is about food security, and we've got one of McGill's own professors to talk about it. Aurélie Harou is a professor in natural resource sciences out at McDonald campus. So without further ado, I'm going to thank you very much, Aurélie, for being here with us today.
Great. Thank you so much. Thank you so much for having me, and thank you all so much for joining me. So today I'm going to talk, as Chris mentioned, about food security during these kind of troubling times. And this is something that you can all probably relate to quite well. In the last 2 months, you've probably gone to the supermarket and have seen a picture similar to this one that I have up here on the slides with empty shelves where you weren't able to find the products you were looking for. And this probably created several emotions, including stress, anxiety, fear, as well as a host of questions, including, but not limited to, and sorry, I'm just having troubles moving my slides. There we go. Okay. So for example, some questions that you've probably asked yourselves are, will I continue to have difficulty in finding some products that I'm looking for in the supermarket, or will it become even more difficult to find some of those products? Why are some products hard to find in supermarkets, but others relatively abundant? Will I be able to purchase these foods that I'm accustomed to purchasing, or will prices increase in the near future? How are food shortages affecting other members within my community? And how is and will the global food supply be affected by COVID-19? How are developing countries doing, and how are they expected to do? So because I'm an economist by training, I'm going to tackle these questions by looking at the supply and the demand for food. And I'm going to focus on kind of North American lens, the US and Canada. And then towards the end, I'll also look kind of more globally at the global food supply. So I'll start with some of the demand factors regarding to the effects of COVID on food. And what you've all probably experienced is this kind of shopping frenzy, which started with a shortage of sanitizers and wipes. And what happened is that this kind of set off a wave of panic buying that spread to different goods, especially products that are easily stored, including consumable goods like dried goods like grains, canned goods, frozen foods, stored milk, and so on. And so what we have seen is an increase in these sales. Rice sales have increased by 50%, canned meat by about 40%. And this is compared to an increase in sales of about 2% last year. So this figure here shows kind of since early January, the increase in sales over time for different goods. So as I mentioned, rice increased about 50%. We see increase in dried beans, water, peanut butter, pasta, pretzels, and so on, these dried goods that are easily stored. And so if you're like me, I found some of this behavior a little bit perplexing, maybe less so for these dried goods, but things like stocking and hoarding of toilet tissue, toilet paper, and water, I found to be a little bit perplexing personally. And so I started looking a little bit at what are some of the kind of psychological factors that are affecting this hoarding behavior. And some of it is rational in that, you know, people are buying because the future is uncertain. There's an uncertain supply or quantity that might be found. Prices might increase. Consumers might be buying more so that they can decrease their supermarket visits and so on. But then there's also these psychological factors that are affecting demand, where there's kind of this herd mentality where when you walk into the supermarket and you're seeing that these shelves are empty, then you're kind of more panicked and you're wanting to buy more to just if you find something that's there. There's also this kind of issue of loss aversion where you might regret, if you find something in the store, you might regret not buying it at that time if you can't find it later. And of course, you know, there's a lot of anxiety and uncertainty regarding COVID. And so food shopping is something that makes you feel in control. And it's something that you can control. And so that helps kind of decrease that anxiety. So these are some of the kind of psychological factors that have induced this kind of panic buying that you might have personally experienced yourselves. In addition to kind of these behavioral responses to demand, we also see kind of changes in preferences and practices. Obviously, restaurants are closed, especially for eating out, although some are open for takeout. But this is also another reason that we're seeing kind of reduced stocks in supermarkets, where a lot of food that used to be consumed through restaurants are now being demanded through supermarkets. French fries, for example, in Canada, 75% of French fries are consumed in restaurants. Not a lot of people are taking the time to make their French fries at home. And so you can expect that because of the demand, there's also kind of a supply issue that we'll get to in a little bit regarding potatoes. And so there's been a decrease in demand from restaurants, but also school cafeterias and college campuses that obviously are closed. And so, the issue is that there's food there, but the supply chain is kind of shifting, and it's taking time to kind of shift into the kind of demands where the new demands are coming into. And then there's also that we see an increase in food delivery services. So things like Uber Eats or Instacart. There's a lot of people asking for kind of groceries to be delivered at home through Whole Foods or Amazon Fresh or other supermarket delivery systems. But while that used to be readily available, now consumers are having to sign up on a wait list. So there's this change in preferences and practices also that are affecting the demand. And then we also have witnessed an increase in junk food purchases. So again, this is tied with the kind of behavioral issues where people are kind of wanting some comfort food. So for example, Campbell's Soup have seen an increase in 59% of sales compared to last year. The kind of Goldfish crackers also about 23% increase in sales relative to to last year. Nabisco and General Mills have seen an increase in demand for flour, Yoplait, Cheerios, items like that. You've probably can relate to this, where you're seeing a lot of your friends on Facebook or Instagram posting, pictures of breads that they're baking at home. So people are baking more. They also want their pantry shelves filled. So increase in those purchases. And this is a kind of a time where actually nutrition is really important. So they found that COVID actually affects those with kind of excess fat, high blood sugar, hypertension, high cholesterol. That kind of affects the immune system. Those are more susceptible to kind of, some of these really strong adverse effects that we're seeing of COVID. So there's kind of an importance to focus on nutrition, but that's not really what we're seeing. People are also needing kind of that comfort. Another factor that's affecting demand is, of course, hugely affecting demand is the income effect. So we've obviously been seeing huge unemployment rises both in the US and Canada. About 30 million people in the US have filed unemployment benefits in the last weeks in the US. The unemployment rate in Canada has increased by about 2.2 to 2.5% in the last month. So of course, this income is going to affect the demand for different products. And food is relatively inelastic, so it's not going to affect food as much, although consumers are going to change kind of what they buy depending on what income is available to them. In the US and elsewhere around the world, they have school feeding programs. In the US, which I'll get to a little bit later, but in the US, it's called the National School Lunch Program, which gives low cost or no cost lunches to public schools or nonprofit schools. And this is a huge program. In 2016, the program reached about 30 million children. And so, of course, with school closures, this has affected their school's ability to feed those children who have really relied on those school lunches. Districts have found a way to continue their school meals, and they've actually also expanded that to include some of the adults or the parents of those school children. And this is kind of becoming a problem because a lot of that is going to be at the cost of the district themselves and not reimbursed by the federal government, because they'll only reimburse kind of school children as opposed to the families and adults. And food banks throughout Canada and the US have been struggling to kind of keep open because of the decrease in volunteer staff, because of a decrease in donations. Yet the demand for food banks has increased tremendously with this high unemployment rates. And so you see people here, I believe this is in Pennsylvania, who are lining up to receive food donations. So just to summarize these demand side factors that have been affecting our food supply, we're seeing this kind of behavioral effect. So there are some kind of policy implementation measures that can be taken, and we're seeing supermarkets who are limiting the number of the quantities that you can purchase of certain goods, the number of packets of chicken that you purchase. Also government regulations against price gouging for supermarkets or individuals who might be kind of hoarding and trying to sell at a higher price. And then we also see this change in consumer preferences. So there needs to be kind of health and nutrition campaigns to remind people to try to lead healthy lives. And then due to the loss of employment and income, we're seeing the Canada Emergency Response Benefit and also the CARES Act in the US, which are kind of supplementing incomes to low income or eligible households. I think in Canada, it's about $2,000 per every 4 weeks for 16 weeks. So that kind of summarizes some of these demand factors that we're seeing in relation to food. And now I'll shift kind of my focus to looking at some of the supply constraints and effects of COVID-19. So one large effect of COVID-19 is through labor. So early March, we saw that, the National Chicken Council in the US said that it was not seeing any disruptions in productions, and there's plenty of surplus. We have plenty of chicken that's stored up to 950 million pounds. We should be fine. But as you can imagine, illnesses in the production and distribution channels were expected to kind of decrease supply, and that's exactly what happened. And when you think about the measures that we're taking to limit the spread of corona, such as social distancing and self-isolation, those are effectively impossible in far more communities. And so workers, especially industries where we see workers side by side, are at higher risk than those operating in kind of more rural and sparsely populated areas like dairy farmers. So what we're seeing is labor shortages now happening in slaughterhouses, where meat plants have become these hotspots for the coronavirus pandemic, which is posing some challenges for meat production. So several beef, pork, chicken processing plants have closed, and they're running at reduced speeds because of the pandemic. So here you see a picture of workers in a slaughterhouse, and they've taken some measures to protect workers, where you see that there's kind of a plastic shield between workers and they're wearing a face mask. But nonetheless, slaughterhouses have closed. The number of cattle slaughtered has dropped about 22% from the same time a year ago, about 6% decrease in hog being slaughtered. And this is not only because of the decrease in demand from kind of restaurants and hotels shutting down, but it also is because of workers being infected by coronavirus. And so you're finding several ranchers having nowhere to send their animals, and they're having to kind of slaughter their pigs and chickens and unable to get them processed. So here's kind of a list of some of the shortages that have been observed. So Smithfield Pork Factory in South Dakota processes about 5% of all the pork in the US. So they closed. They had about 400 or so cases of, or 600 cases of corona, which was about 44% of the total coronavirus cases in South Dakota. So again, it was really this hot spot. 4 workers at a JBS plant, which is one of the world's largest beef processors, 4 workers in Colorado died of the virus. Several workers at JBS Canada have tested positive. That's based in Alberta. 3 workers at Tyson Foods in Georgia have died. Several poultry plants in British Columbia have tested positive. And Cargill Slaughterhouse have closed in High River, Alberta, after about 484 cases were detected. This kind of made several headlines because McDonald's, which is proud to kind of use Canadian beef in Canada, is now said to be importing their beef. Cargill in Pennsylvania are also now producing steaks sorry, have now also closed, which were also a large meat producer. So, so what is the government kind of doing to kind of mitigate this? So in the US, Trump has ordered an executive order to keep meat processing plants open as they're considered critical infrastructure. And so there was kind of a swift backlash from labor advocates who said that, you know, more has to be done. If you keep these slaughterhouses open, then more should be done to protect the workers who work in them and who are risking their lives to keep working. And in Canada, President Trudeau has not, you know, ruled out the possibility of also doing something similar, but it hasn't happened in Canada yet, and that may be something that happens. So in terms of another kind of constraint, going back to the labor rights, so there is indeed a high anxiety related to the pandemic among frontline workers for different jobs and different categories in the food industry. And so there's been kind of this increase in protests that have happened in different companies to try to increase the measures of safety for them. So Instacart, for example, demanded greater pay, better access to paid leave, more access to disinfectants. In Staten Island in New York, Amazon warehouse workers walked off the job, demanding kind of greater protection. Workers at Whole Foods also demanded paid leave for workers who had to isolate themselves and wanted doubling of pay to compensate for the risk of working during the COVID crisis. So in addition to this kind of labor shortage in slaughterhouses, we're also seeing labor shortages due to migration restrictions. And this is for many large farms who rely on workers from different countries for their harvest or different parts of the cultivation cycle. And these workers are no longer able to travel, so that's a huge supply shortage. And this is happening really throughout the US, Canada, and Europe. In Germany, they rely on 300,000 seasonal workers. Italy, likewise, for food products, for about a quarter of their food products, they also rely on about 370,000 seasonal workers, mainly from Eastern Europe. In Canada, we rely on about 60,000 workers coming mainly from Mexico, Jamaica, and Guatemala. And in the case of Canada, the federal government has exempted temporary foreign workers from the travel restrictions, so they should be able to travel. So moving on a little bit to a phenomena that we're also observing is increase in food waste. And this is really tragic because, you know, on the one hand, we're seeing more people line up at food banks, but then we're also seeing cases where farmers are forced to destroy, you know, tens of millions of pounds of fresh food that they can no longer sell. And this goes back to an earlier point I made, where there's kind of, there's still this demand for food, but it's kind of the difficulty in shifting how it travels through the supply chain to those consumers. And so this decrease in demand from restaurants, hotels, and schools is making it really difficult for certain farmers to find new customers. And so in some cases, tractors are having to kind of, you know, get rid of and crisscrossing their perfectly ripe vegetables directly in the field. And that's something you can see in this image here. For example, milk supply has about 5% of the milk supply is being destroyed in America. And of course, you know, with the dairy industry, cows have to continue to be milked. And so, you know, they have to continue milking in order to kind of keep production up. And so 5% or 3.7 million gallons of milk are being dumped every day. And so many farmers are trying to donate that surplus food to these food banks. But of course, it's difficult in some of these cases with perishable goods. And then there's also an added cost of harvesting and processing and shipping and transporting these products to these food banks or other areas in need, which would put an additional strain on farmers who already can't really find customers and who are going to have financial kind of repercussions. And we see a slight increase also in people interested in home gardening. So in World War I, there was a Victory Garden movement, which really encouraged people to grow more food at home. And this continued and kind of resurged during World War II. And now we're talking about these Corona victory gardens. And there's a huge spike in seed sales. Google searches for home farming jumped by 50% in March. How to raise chickens spiked 75% in March. So there's also an interest in kind of, producing locally and producing in your own garden for those who can. And lastly, we also see an effect on trade, of course, from coronavirus. And, we're seeing kind of products piling up in some ports and warehouses. And other places, cargo ships are sailing empty. And Canada relies substantially on trade, both to sell its output, but also on the inputs that come from import to grow those outputs. So for Canada, they export about half of their agricultural production. We export about 50% of beef, 70% soybeans, a large percent of wheat, canola, pulses. And the World Trade Organization is forecasting between a 13 to 32% decline in global trade. So of course, this is also going to affect the food supply, both internationally, globally, and within Canada. Luckily, the food sector is slightly insulated by kind of the low income elasticity of food. Food is necessary. So especially for products like breads and cereals, you see a very small income smaller income elasticity for those goods, slightly higher for fruits and vegetables, and then a little bit higher still for protein foods. But so this decrease in trade in terms of the agricultural industry will be slightly shielded, but still we can expect kind of a decrease in exports. And then likewise, fruits and vegetables in Canada are imported, mostly are imported from the US, so the availability of fresh foods is going to depend on foreign producers. So it's linked, intricately linked. So then just to summarize, in terms of the supply side factors, so we saw that there was kind of a decrease in labor due to high contamination of coronavirus in slaughterhouses, and also decrease in migrant workers being able to help out on farms. One way that's been tackled is through this executive order to kind of keep those plants open, and or also to kind of keep borders open for migrant workers. In terms of the food waste, governments can implement different policies. In New York, for example, Governor Andrew Cuomo agreed to buying back all of the kind of milk that's being dumped by dairy farmers. In Canada, the Farm Credit of Canada has increased its lending capacity by $5 billion, so that's going to help farmers also kind of weather some of these shocks. And the Farm Credit Canada clients are also going to be kind of offered deferment of payments of existing loans. And we're also seeing a reduction in trade, and so governments can take different kind of measures to encourage that trade to continue while still taking the precautionary measures to decrease the spread of the coronavirus. So I want to turn just briefly to end here, kind of at, looking at the global food crisis. And recently, David Beasley, who's the executive director of the United Nations, the World Food Program, has said that we're not only facing this global health pandemic, but we're also looking at a global humanitarian catastrophe. And he's expecting that there's going to be famine in about several dozen countries. And the World Food Program is predicting that an additional 130 million farmers or people, smallholder farmers or people globally could go hungry in 2020 due to COVID. And that's in addition to the 135 million that currently face acute food shortages. So that's about a doubling. And the difficulty, especially in developing countries, is that the supply chains and the distribution and retail sectors of these countries are not so automated and not so organized. And so these food systems are much more reliant on labor, and so the supply chain is much more vulnerable to kind of these social distancing regulations. Additionally, about 4 out of 10 people worldwide don't have hand washing options. So you can imagine that coronavirus might spread, much more rapidly in these communities. 1/3 of health centers in impoverished countries don't even have hand washing facilities. And additionally, polio eradication through vaccination and vitamin A distribution campaigns are suspended. So there's kind of another, host of other health factors that could worsen. There's a few things that are in the advantage of these communities. One is, for example, we know that coronavirus affects the elderly more dramatically than most, and a lot of these populations are much younger on average. So about 2% of the population in Burkina Faso and Ethiopia, I believe, are over 65 years old. And that's in comparison to about over 20% of the population in Italy who's over 65 years old. So the populations are much younger. And also these countries also have much higher kind of obesity rates, which are also thought to increase the risk of adverse effects of coronavirus. So there's a few things that are more advantageous in thinking about how coronavirus will affect these communities. Likewise, as I mentioned, as was the case in the US, a lot of countries have kind of these school feeding programs, which have been closed now since schools have closed. So again, that's another kind of way that the coronavirus is affecting food security. A lot of students, especially girls, will probably never return to school after schools have closed because that's already a current problem. There's also currently kind of a locust plague that's happening in the Horn of Africa, and travel bans are kind of disrupting the supply of pesticides in these areas. And so food security is predicted to deteriorate in certain countries more than others. Sudan, Yemen, Zimbabwe, for example, were already struggling before the outbreak, so those will not fare well. Oil exporters like Iran depend on oil revenues to buy goods like food and medicine, and due to the decrease in oil prices, that will be more difficult for them. In Venezuela, government supplied rations have run out. In India, daily wage workers have reported being more worried about food than the virus. Migrants are unable to return home due to travel restrictions and so are reliant on government soup kitchens. And generally, food importers are expected to be worse off in terms of food security. So I'd like to conclude just by saying that, we expect, or people say that the coronavirus is non-discriminatory and that it affects poor and rich equally. And while that may be true in terms of, its health effects, when we look at its indirect effects, especially as it relates to food security, that's not kind of what we're expecting to see at all. Poorer and more vulnerable communities, both in North America and abroad, are expected to be, are being worst hit by coronavirus. And for others, we can expect to see kind of intermittent food supply shortages and possible price hikes, and that might require kind of this temporary substitution of products. And when we look at risks of food insecurity, what we've seen in the past is that can sometimes lead to rioting. And so, if some of you might remember the food riots that happened in 2007 and 2008, already we've seen some rioting happening in South Africa and Colombia. So it's critical for governments to really take the adequate measures to deal with the coronavirus implications of the food system. So I guess that concludes the talk, and thank you very much.